and so we're going to be talking about dental hygiene. What people do with sexual situations when they have gum problems.
Talking about our own experiences and what have we learnt in the process. So you've probably either been told by a dentist or a doctor that you have a mouth problem, and this could be either gum disease or maybe you've got a tooth that's coming out that you're worried about. You've even been told that you have to sleep with a mouth guard or you have to have braces. All of those things can really, really fuck up your confidence when it comes to sex, especially because the first thing you think of is, holy fuck, how can I even kiss somebody? The best news about it is that all of the worries you have are mainly all in your head. It's mainly all just built up, and it's this idea that you won't be able to do those things anymore when it shouldn't affect your life at all. So
the most common thing, I guess, is braces. I mean, a lot of us have braces when we're growing up and going through puberty.
That's like what, our sexual awakenings normally at that age. And we've had quite a few questions in already asking, how can I give a blowjob with braces? What about kissing? Does it get caught up? Well, braces should not affect your sexual life at all.
No.
Especially oral sex. It does not affect oral sex at all. It's on the outside of your teeth. As long as you're not rubbing the front of your teeth on anyone, you should be absolutely fine.
Blowjobs especially, your braces are not an issue at all in that situation, because you do not use the front of your teeth in a blowjob in the slightest.
You could be a little bit more careful, but as long as you're normally careful with genitals in your mouth anyway.
With giving oral to a woman, if you have braces, then you do have to be a tiny bit more careful because it's more of a flat surface.
No smudging and pressing again. Use your lips.
Use your lips and your tongue. And you could also use a few fingers if you feel you're not doing enough with your tongue and lips.
Always swap and change. Now the other big one is dental problems or gum hygiene. I've had a few people before in the past saying that they've been told that they've got a gum disease and oh my god, it's really awful, and it's not that bad. It really isn't. It's something that you have to take care of, but it's not something that will stop your sexual fun. It's not something that should make you feel less confident about yourself. I've been told by my dentist that if you do have gum disease, Corsadil is one of the best things, but do not use Corsadil on a regular basis. Do not use it every day because it destroys the plaque and the enamel on your teeth. So same with any chemical you're using every day, please do your research. I've also been told by my dentist, if you use a mouthwash every day, make sure it's alcohol free, because the ones with alcohol in it can fuck your teeth up. Again, that's what she's told me, so it might not be the law, but if my dentist tells me that, then I'd rather be safe than sorry. You do have to be worried about your breath and halitosis, as long as you keep on top of that. If you are worried about your teeth or your breath or your mouth or anything, please go to a doctor and a dentist. Get a professional medical opinion. But you just shouldn't have to worry about it as much. Every worry you have is going to be built up in your own head because you're basically mouth to mouth with somebody and you think they can taste the inside of your mouth.
Yeah, your mouth is such an important part during any sort of sexual situation, because the kiss is where it all starts.
I don't kiss when I fuck. So I am a chronic grinder. I grind my teeth when I sleep, and it's something I cannot help. It doesn't matter how stressed or how relaxed I am, I do it every single night, and I have lived with mouth guards all my life. They are gross, and my dentist jokes saying it's the passion killer. The last thing you want to do is, like, after you've had sex, you put in your sexy mouth guard.
The passion killer is not what you want.
And you look all gross, you're just like, good night, darling. Like drooling everywhere. No, it's not that bad. I mean, I felt really self-conscious of it for years, but it really isn't that bad. The only worry about them is that they can smell if you don't clean them properly. But make sure you keep on top of the cleaning. I've had a few gross mouth guards in my time. They used to make them really thick, really chunky, and they would stick out and you couldn't close your mouth properly. This is a jaw correction mouth guard. It's massive. I can't sleep with it. I spit it out subconsciously. You cannot close your mouth with this as well. It's pretty horrible. So that hits in like that. It's fucking horrible. I don't think anyone needs to deal with this shit, but you can speak to your dentist and find out what the better options are in mouth guards. You don't have to get a big, fat, chunky, rubbery one. I've just been given this new, amazing mouth guard that's changed my life and the way that I've thought about sleeping with a mouth guard. And it's basically like a braces retainer. So it's tiny.
Oh my god, that's so much smaller.
So much thinner. I can close my mouth around it. I mean, it's a little bit wonky because it's trying to make way for my wisdom tooth. They're still uncomfortable to sleep with, and my lovely boyfriend, he's nice enough to put it in for me when I fall asleep without it. That's true love right then and there. But that fits in like this. So you can like hardly see it at all.
Bad at all.
Kind of can talk normally with it. I mean, we always joke like, oh yes, I'll put this in, let me suck your dick now. But it's more just like taking the piss out of it. But yeah, it's a fucking nuisance when you're sleeping around and dating people and you're thinking, oh my god, if I don't have my mouth guard with me, like what the fuck am I doing to my teeth at night? Just be completely confident with it. I am completely 100% confident with it now. You know, if I was sleeping with a new guy, I'd be like, mate, this is what I have to deal with, and if you don't want to fucking deal with that, it's your fucking problem.
I don't think that's a bad, like, that is really not that bad.
You know, that's my new dentist that's done that for me. Thank you. Do not worry if you've been told that you have some sort of dental issue, especially if you've been told you have to get a tooth out. That sucks, and it can really change how you feel about your face and your smile.
Yeah.
But remember that if your smile means that much to you, it's worth every single penny to get fixed.
Definitely. Definitely.
I truly believe that if you are really unhappy with something, push and push. You know, go into private dental care if you want something to be done about it. The NHS is still great for things like that. You know, I've had all my mouth guards on the NHS, even though they're about 60 quid each. But it's just so much worth it. I feel so much more confident with this one now.
So if you have any of these, then just don't get it worked up about it in your head. Like, it really isn't as bad as you think it is.
And your partner should love you enough to understand, or anyone that you're with. It's your mouth. It's like one of your main points of your body. It's the main hole. It's one of the main holes of your body. It's very sexually related. As long as you feel confident about it, then it doesn't matter what anyone else thinks. Let me know if you have any mouth problems at all. Please let me know. I'd love to hear from you. And if you're wearing a mouth guard, if you grind your teeth, let me know too, because it sucks. And let's fight this together.
Don't let it ruin your sex life.
Absolutely not. I definitely don't let it ruin mine.
Yeah.
Especially because I'm sleeping. I'm like, well, bye now. I'm just gonna go grind these motherfuckers down.
So see you next week.
Bye.
Bye.